Heart attacks and pulled muscles can present with similar chest discomfort, making it crucial to distinguish between them for appropriate care. A heart attack typically causes severe chest pain that may radiate to the arm, neck, or back, along with symptoms like shortness of breath, cold sweats, and nausea. On the other hand, a pulled muscle in the chest often results in localized pain that worsens with movement or palpation of the affected area. Treatment for a heart attack involves emergency medical care, including medications and procedures to restore blood flow, whereas a pulled muscle usually responds to rest, ice, compression, and over the counter pain relievers. Recognizing risk factors, such as a family history of heart disease, smoking, high blood pressure, and an inactive lifestyle, can help in assessing the likelihood of a heart attack over a muscle strain. Let's dive into the detailed aspects of distinguishing these two conditions to ensure prompt and appropriate medical response. Affected systems: cardiovascular versus musculoskeletal. Heart attack symptoms can mimic those of a pulled muscle, as both conditions can cause chest pain. However, the nature of the pain differs. A heart attack usually presents as pressure, fullness, or squeezing pain that can radiate to other areas like the jaw, arm, or back. It's often accompanied by shortness of breath, sweating, palpitations, and sometimes nausea. Conversely, a pulled muscle tends to be localized sharp or aching pain, aggravated by movement or touch, and doesn't come with the systemic symptoms seen in heart attacks. Crucially, while muscle pain might subside with rest or anti-inflammatory medication, heart attack symptoms persist and warrant immediate medical attention, as they signify a cardiovascular emergency. Onset of pain, sudden and severe, versus gradual and localized. When differentiating between a heart attack and a pulled muscle, the onset of pain plays a crucial role. A heart attack typically heralds itself through sudden and intense chest pain that may feel like pressure or a squeezing sensation, often radiating to the left arm, jaw, or back. This pain can be accompanied by other symptoms such as shortness of breath, nausea, or lightheadedness. On the contrary, a pulled muscle pain usually emerges gradually as the muscle is strained or overused. The pain is localized to the specific muscle group affected, increasing with movement or palpation, and isn't accompanied by the systemic symptoms characteristic of a heart attack. Identifying these nuanced differences is paramount for timely and appropriate medical intervention. Associated symptoms: systemic, each sweating, nausea, versus isolated. Heart attack symptoms can mimic the discomfort of a pulled muscle, especially when the chest area is affected, causing confusion in self-diagnosis. However, crucial differences aid differential diagnosis. A heart attack often presents with systemic symptoms like sweating, nausea, shortness of breath, and a sense of impending doom, which saturate beyond the site of pain. These symptoms may intensify over minutes to hours. In contrast, a pulled muscle tends to cause localized pain, usually exacerbated by movement or palpation of the affected area, and lacks the systemic manifestations associated with a heart attack. Knowing these distinctions is vital, since timely recognition and response to a heart attack can be life-saving. Pain character: crushing or pressing versus sharp or aching. When discerning between the symptoms of a heart attack and those of a pulled muscle, the character of the pain is a pivotal indicator. Heart attack pain is often described as crushing or pressing, frequently accompanied by a sense of heaviness or tightness. It may radiate to the neck, jaw, or arm, and can be associated with shortness of breath, sweating, or nausea. In contrast, pain from a pulled muscle tends to be sharp or aching, localized to the affected area, and is usually exacerbated by movement or palpation. A pulled muscle would also not elicit systemic symptoms like those seen in a heart attack, aiding in the differential diagnosis of the underlying condition. Trigger factors: exertion stress versus movement strain. Heart attacks often strike with sudden chest pain or discomfort that may radiate to other areas like the neck, jaw, or arms, typically triggered by exertion or stress. The pain is described as pressure, fullness, or squeezing, and can be accompanied by shortness of breath, sweating, and nausea. In contrast, the pain from a pulled muscle is usually localized, sharp, or aching, and closely linked to movement or strain. It can be reproduced by stretching or using the affected muscle and lacks systemic symptoms. While both conditions can cause significant discomfort, recognizing these differences is crucial for timely medical intervention in case of a heart attack.